October is Breast Cancer Awareness Month, and every Monday, Komen for the Cure will bring you news and information about breast cancer prevention and treatment. And joining us this morning is Dr. Stephanie Graff. Thanks for being here with us about cancer prevention. And there's a lot of misconceptions out there about breast cancer. Tell us what may be the #1 myth out there for women.
Yeah, I think one of the biggest myths is that you have to have a family history in order to get breast cancer. A lot of women think, well, no one in my family's had breast cancer, so I'm safe. And only about 10% of breast cancers actually have a family history associated with them.
That's it, just 10.
So just because no one in your family has it doesn't mean that you shouldn't be getting your screening mammograms.
What about the bra that you wear?
Yeah, lots of bras have been implicated. A lot of people think that wearing underwire bras increases the risk of breast cancer, and that's also been sort of debunked in the popular medical literature. We just don't see that that's true. There was some concern that underwires may put extra pressure on the breast and increase that risk, but it hasn't been shown true.
Is there anything in regards to deodorant? You've heard so many different reports that say that could be cancerous, antiperspirants.
Yeah, and that's another myth. Not true. Wearing deodorant or antiperspirant, regardless of the brand, doesn't seem to increase the risk of breast cancer.
Okay, and we've also heard number three myth is small-breasted women. They may not have as much of a chance to get cancer.
Right. Small-breasted women, large-breasted women, the risk of getting breast cancer is the same regardless of the size of your breast tissue. I think that the concern is that larger-breasted women may have a harder time getting all their breast tissue examined. Doing a self-breast exam, they have to cover a larger area. Getting a screening mammogram, they have to get a larger amount of breast tissue visualized. So there may just be issues with visualization that makes that seem true.
Okay.
But regardless,
not true.
Yeah, not true. Regardless of the size of your breast, your risk is the same, and you should be getting those screening mammograms.
Doesn't matter the size. Number 4 myth, and that's the final one: caffeine causes breast cancer.
Yeah, caffeine has been shown to possibly increase breast tenderness, particularly for women who have fibrocystic breast disease. So if people have kind of lumpy, brumpy breasts, if they notice that they go on a caffeine binge, their breasts may ache more, but that in no way relates to breast cancer risk. And so caffeine intake won't be increasing your risk either.
All right, well, there you go. Dr. Graff giving us the myths about breast cancer. We appreciate your time, and you'll be back maybe next week.
Yeah, thank you.